So this is Diego García Borreguero. I'm the current chair of the International Restless Leg Study Group. In most cases, RLS is going to be a chronic disorder. At this point, we don't have any prospective studies looking at the long-term course of restless legs. However, when this question is being asked retrospectively, that means we take a sample of patients and we ask them, how did your symptoms develop until now? We will see that the vast majority of these patients are going to report that the course of the disorder was continuous. In this study, it was reported as being continuous by 80% of the patients. So that means, in other words, in most cases, we are going to have to provide a continuous pharmacological treatment over most of the patient's life. So, what are the objectives of treatment? What are we trying to achieve when we treat an RLS patient? First, we want to alleviate sensory and motor symptoms, but not only that. We want to improve sleep as well. We want to improve the quality of life. And this might become particularly important for the future. We might also want to prevent any physical impact of RLS wet symptoms, particularly cardiovascular complications. It might be that one day what we try to achieve is to prevent hypertension and the cardiovascular risk from occurring in patients with RLS. So it's important to keep in mind that RLS wet symptoms can be effectively treated. So far, virtually all dopaminergic agents have shown to be effective and quite spectacular treatments for RLS symptoms. This has happened on virtually any dopaminergic drugs. They should prove to be more effective than placebo. However, not only that, also if the effects of any of these treatments on quality of life prove to be superior to the one on placebo. However, accepting the fact that these drugs are effective for the treatment of RLS symptoms, the question now is, we're going to provide long-term treatment to these patients, and what is the evidence that these effects are lasting over the long term? So everything we know so far is that these drugs have a short-term efficacy over RLS treatment, but is this effect going to last for a longer period of time? Well, what can be seen on the screen are the effects of the results of three different studies on pramipexole versus placebo. Pramipexole is shown in green and placebo is shown in orange, and the column shows the mean change under pramipexole versus the mean change under placebo. What we can see is that the longer the study, the longer the duration of the study, the shorter the difference between the effects of pramipexole and the effects of placebo. And so far, we're showing just studies that had a duration of only 12 weeks. So what would happen in a drug that is going to be administered for most of the patient's life? What does it mean in terms of long-term efficacy? Well, we have more data on a study that compared placebo with pramipexole over 6 months. And what we can see is that the differences over the 6-month period get smaller and smaller as time goes on. At the end of the 6-month period, the differences between the effects of pramipexole and the effects of placebo were 2.6 points on the IRLS severity scale. This difference was still clinically significant and statistically significant, but it was getting narrower and smaller and smaller over time. The problem is that so far most of the agents that we have for the treatment of RLS have been studied over periods of time that were not sufficiently long. What is being shown on the slide is the longest study performed so far on ropinirole, which is a little bit over a year. For pramipexole, the situation is even worse because we have studies lasting no longer than 6 months. For cabergoline, the situation is the same. For pergolide, little more than a year. For levodopa, the same, 1 year. And for rotigotine is the exception here because we have here data over 5 years. What I'm showing on the next slide are the effects over the 5-year study of rotigotine in RLS patients. And what we can see on the left side of the slide is that the effects of rotigotine are maintained over that long period of time. The right side of the slide shows the dose at which these effects were achieved. And what we can see here is that these therapeutic effects of rotigotine did not occur at the expense of an increase in the dose. So the same dose of rotigotine kept a stable efficacy over a long-term period of 5 years.